Let's learn about septal hematoma. Hematoma means collection of blood, whereas septal hematoma means collection of blood in the septum. This is a diagram showing a normal septal mucosa. This is a normal nasal septum mucosa along with the septal cartilage. When the blood is collects in between the nasal mucosa and perichondrium or the periosteal layer of the septum, then it is called as septal hematoma. Common etiologies which leads to this septal hematoma are following a trauma, either it may be a road traffic accident or assault, and occupation wise it is most commonly seen among boxers and sports person. It is hydrogenically seen in septoplasty or submucosal resection surgeries. Following surgeries, septal hematoma may be seen, and spontaneously without any history of trauma, it is seen among the patients suffering from bleeding disorder or coagulation disorder. The patient comes to the hospital with a complaint of bilateral nasal obstruction. The bilateral nasal obstruction, because septum is a midline structure and the swelling causes bilateral septal swelling will be there, which causes bilateral nasal airway obstruction. So the patient will present with the bilateral nasal obstruction and pain will be there because of the airway compromise. Patient also having mouth breathing symptoms. On examination, there will be a smooth round swelling of the septum. On palpation, which signifies the swelling is soft and fluctuant in consistency, which signifies the fluid filled swelling of the septum. And whenever we see a septal hematoma, that should be drained immediately because it leads to some of the complications. The treatment options available are: we may use a wide bore needle aspiration to remove the collected blood, or we may use a needle and plan for incision and drainage to drain all the blood collected in the septum. The incision preferred site is along the floor of nasal septum, a horizontal line drawn from anterior to posterior. This is the preferred incision to drain the septal hematoma. Along with this drainage of the septal hematoma, we also give analgesics to relieve the pain symptom and antibiotics to prevent further septal abscess formation. And some of the complications of this untreated septal hematoma leads to septal abscess, that is pus formation, and bacterial growth will be there, which leads to septal abscess formation. And when a long-standing abscess leads to absorption of the septal cartilage, which eventually leads to necrosis of the cartilage. This in turn leads to the septal perforation, and it also leads to the dorsum of nose absorption, leads to deformity of the nose. The significant deformity of nose is saddle nose deformity. And when the long-standing hematoma may also lead to thickening of the nasal septum. These are some of the complications when the septal hematoma is left untreated. So whenever we see the septal hematoma, that should be drained and treated immediately to prevent further complications.